Hi everyone. So today we'll be knowing something about ectopic pregnancy. What exactly is ectopic pregnancy? What are its risk factors? How do we diagnose and treat it? So ectopic pregnancy affects 1% of the pregnant females. It is a condition when the fertilized egg it sits and starts growing outside the normal uterine cavity. So if your pregnancy is sitting and growing outside the womb, it is an ectopic pregnancy. Why it is important to know about ectopic pregnancy and what are the risk factors which women can have ectopic pregnancy. So it's important to know if you have previous history of infection of your pelvic area, that is your cervix, that is the neck of the womb, tubes. If they have been infected earlier, then there are chances that these infected tubes may be blocked at places, may not be functioning properly, and this increases your chance of ectopic pregnancy. So previous history of any sexually shared infections including chlamydia, gonorrhea, tuberculosis increases your risk of ectopic pregnancy. Thereafter, women who had previous ectopic pregnancy, they are at a higher risk of having ectopic pregnancy again. Any congenital defects in the fallopian tubes is another risk factor. Any infection of the your intestines or appendix or your lower tummy is another risk factor. Then smoking. The females who smoke, they are at a higher risk of having ectopic pregnancy. So these are some of the risk factors which may predispose you to have an ectopic. It's very important that in case you are pregnant, we rule out and treat ectopic pregnancy, because whenever the fertilized egg it is sitting and developing outside the normal uterine cavity, these structures, example tubes or any other structure where the fertilized egg it starts growing, they do not have that much capacity as that of womb to expand. So eventually they may burst, they may tear, and this can result in torrential bleeding. It can be a life threatening situation for you. So whenever a pregnancy is at abnormal location, that is at any place outside the normal uterine cavity, it is labeled as ectopic pregnancy and it should be treated as early as possible. Talking about the symptoms, so there are three cardinal symptoms of ectopic. The patient will miss her periods. She may have pain in her lower tummy and she may have slight spotting and bleeding. Apart from this, there can be other symptoms like she may have giddiness, fainting attack. She may have shoulder tip pain, because if there is collection of the blood inside the tummy, it will stimulate the nerves which supply your shoulder also. So the patient can have shoulder tip pain. She can have problem with her urination, with her bowel also. So if you are pregnant and if you have any such symptoms, it is important that ectopic pregnancy is ruled out. In many cases, through the symptoms, we may suspect that the patient is carrying an ectopic pregnancy. But yes, with the help of transvaginal sonography, the diagnosis can be confirmed, where an abnormal mass can be seen outside the womb, or there may be blood present in your tummy in case the ectopic pregnancy has ruptured. So transvaginal sonography, that is a ultrasound in which a probe is introduced inside your vagina to have a close look at your womb, ovaries and tubes, is used to diagnose ectopic pregnancy. The other test which we need to done is which are need to be done are complete blood count. We need to know your hemoglobin levels, your blood group, what RH type you have, and then the other routine blood tests are to be done, and the pregnancy hormone levels, that is the beta HCG. Beta HCG is a pregnancy hormone, that is the hormone which is secreted by the placenta by the afterbirth during the pregnancy, that is beta HCG. So that value of that hormone is also to be checked. Depending upon your symptoms, what is the size of the ectopic mass, that is the size of the pregnancy which is growing outside the womb, your symptoms and beta HCG value your further treatment will be decided. So it can be expectant management, it can be medical line of management, and it can be surgical line of management also. In our next video, we will be knowing more about this. I hope this video was useful. Thank you so much for listening.